This is Jerry Hesch with the Hesch Institute in Henderson near Las Vegas, Nevada, and this is a case titled Severe Disc Degeneration L5-S1. That's per MRI and X-ray report. And if you look at the X-rays, which we'll show later on, perhaps in part 3 or 4, it's very apparent. And part of the belief has been, with her seeing several clinicians, that she probably has pelvic joint instability. So this is part 1, and this is the Hesch Institute in Henderson, Nevada, close to Las Vegas, Nevada. Spelled H-E-S like Sam, C-H. That's our website. And Deborah, can you give us a brief introduction, please?
Well, I'm from Calgary, Canada, and I came to the Hesch Institute because I have been struggling with chronic severe pain for 17 years.
And it was?
The delivery of my second daughter brought on symptoms that left me unable to stand or sit for any more than 2 minutes. The only thing that gave me relief was laying on my right side with a pillow between my knees.
How long did that persist?
A year.
Okay.
Yeah.
And after that?
After that, the pain sort of moved and it shifted to the front of the pubic bone, the pubic joint. I had severe pain from the top of my hip right down to the joint. And from that point on, I spent, oh gosh, a couple of years maybe sort of dragging my leg and not able to take full, didn't have a regular range of motion without causing a lot of pain, extreme pain.
And you also had a fall?
Yes, I had a fall with my first daughter, and I fell on some ice and I couldn't use my arms to brace myself, so I pulled her close, my right leg hyperextended, and I fell back on it and heard several snaps and had to have surgery on the ankle and the outside of the leg.
So now your ankle is fused?
Now it's fused.
Yep.
Yeah.
All right. So I watched you walk in with a cane, and you were certainly moving rather slowly and obvious that you hurt. And we did our evaluation, and I then put an SI support on you, except I put it much lower. I put it on the level of the trochanters. And prior to that, you couldn't tolerate an SI support.
No, I couldn't wear the SI support. It would cause spasms in the piriformis, and it would make my SI joints hurt. My lower back hurt, my sacrum.
So then I applied it, and how did you feel when we put it on very low?
Different, stable.
You walked very differently, and you walked
totally
without
different.
the cane.
Yeah.
So then I put a lumbar support.
Yes, correct.
And that did what?
And that just even provided more stability.
So right now you're standing there with a good lumbar support and an SI. And an SI support worn really low. You can't see it.
Really low.
Yeah,
yes.
The film, it's black and it's, so you can't see it. But let's watch you walk. I mean, this is a very different person walking. This is very different simply in response to putting on 2 supports.
Yeah.
And we had you stand a moment ago on a bilateral scale and checked how much you were unweighing one side of your body, and it averaged somewhere around 5 pounds. You were quite stable. One time I saw 9, and then I saw 3, and it danced around, but I never saw it go higher than 9. We'll recheck that when we take these supports off you. Okay. So we're looking at you in reverse, and let's have you lie on your back, please. And I said your legs you're as weak as a kitten, right? When I tested your leg strength. Put your legs out straight. You can bend this left leg.
Oh, okay.
And then can you lift the right leg up? Good. Wow. Hold it right here, please. Hold it there. Don't let me push it down. This is incredible.
Yeah.
This is amazing. Because prior to that, you could not lift it higher than, say, 8 inches.
Yeah.
And I pushed it right down, and that was on both sides.
Yeah. Because I didn't know what to recruit to. I can't describe it any other way. I couldn't find the muscles to recruit what I needed to use to hold it up.
Interesting. Let's try the other side, please. We'll lift that up. Good. Hold it there. Show me how strong you are. Hold it there. It's just amazing. Yeah.
And my core is even working now.
Good. How can you tell? What does that mean?
It means I can feel it coming in and recruiting. Like it's just going, oh, okay, yeah, I'm here.
Interesting. Okay. That's enough. I mean, we could do all manner of testing. I'll just do one more thing. What was painful if you put your legs out straight? It was painful when I tried to spring the pubic joint.
No, no pain.
No pain there?
No.
I'm pushing on the right side. I'm walking across midline to the other side. And
there's still a little bit there.
You know,
yeah.
It's funny, but I swear to you, that moves more than the other. It just feels like it's not stable. It feels like it could keep moving. Now, this was distinctly painful when I did this to you.
No, hardly anything.
And you know what's incredible? It springs right back. I can load it, and I can spring it, and it springs right back with integrity. Okay, can we take this off?
Yeah.
All right. So we're taking the lumbar support off. Okay. I'll repeat this test.
Yeah, there's a little bit more pain.
And I take it the slag.
Yeah, I can feel that.
And I spring it. There's no recoil.
Yeah.
That's incredible. I take it the slag, and I spring it, and it just like stays there and then comes back.
Yeah.
That's odd. Bend this knee, please. Okay. Can you lift this leg up?
Okay.
That's the limit?
Yeah, that's about...
Show me how strong you are.
Yeah.
That's remarkable. So, although this is called a lumbar support, of course it does go around the pelvis as well. You know, that's interesting. I did just spring this, and it did feel painful. Okay. So let's have you walk around with only the SI support now. And the SI support again is worn very low. That's the key. It's worn around the trochanters, and the research shows that applies 40% more compression. So my impression, you're walking a bit slower.
Yeah.
You're definitely walking slower, and I think you're unweighing one side of your body.
Yeah.
How do you feel?
I feel
Am I putting words in your mouth?
It feels, this is heavier, longer.
On the left. You're pointing to the left?
Yeah.
Okay. Could you stand on that scale, please? And we can see your perturbations. You shift from side to side, and the numbers are much higher. You shift as much as 16 pounds. You're at 12 right now, 16, 14, 13. Now you're down to 9, then you went to 11, 14. And I'm presuming you're putting more weight on the right. Is that true, or can you tell? Now you're at 6, 5?
Yeah, I am. Yeah,
okay.
Yeah, I am.
Alrighty. Let's do another experiment. Can we take that SI support off? Okay. So stay on the scale, please.
Oh, okay.
And how do you feel in terms of your balance and stability?
Yeah, it feels funny.
Feels funny.
Yeah, like it doesn't feel like I can sort of find it.
Okay. Okay. All right. So can we have you walk?
Was it different? Or?
It was different.
Yeah.
You were alternating from side to side in terms of how much you would unweigh.
Yeah.
Yeah, because you went into the negative, like.
Right.
Sure. All right. So go ahead and walk.
Okay.
And there's just a distinct, even a further reduction in speed, and it looks like you don't like putting weight on that left side.
No.
So your body shifts way over to the right to help unweigh it. And we'll just show really quickly on the table.
Okay.
I think what we want to show is the fact that legs out straight. I know that I didn't demonstrate that before, but you're unhappy when I'm at 45 degrees.
Yeah.
And where do you feel that?
Just in the back of the legs, and like I said, I don't know what I'm recruiting to be doing that. It doesn't feel like the brain is making that connection.
And when we put the SI belts,
yeah, then something was like,
we went
oh,
to 90 degrees.
yes.
We went all the way up there.
And I didn't feel nervous.
Right. And then when I do this test,
yeah, I can feel that.
what does that feel like?
Yeah, it's sore.
Okay.
Yeah, it's not as sore as when you did the first time, but I can definitely feel it.
Okay, so it's definitely more.
Yeah.
So it's interesting that both of those supports together gave you significant relief, much more so than a single one.
Yeah.
And it's a difficult presentation. Your x-rays of your pubic joint don't show a significant width, but you may have an anterior posterior hypermobility, which is what I feel on the left side.
Right.
And this is just one person's subjective perception, but it's also yours. When I push on the left side of your pubic bone, what do you feel?
Pain. Like it kind of could go on forever.
That is precisely what I feel.
Yeah, it could go on forever.
That's precisely what I feel. So I'm going to finish this filming for right now.
Okay.
And thank you very much. I really appreciate this.